Frozen pizza may seem like a convenient and comforting meal, but for individuals with high blood pressure, it represents a triple threat due to its combination of high sodium, saturated fats, and processed meats. The danger is insidious because the pizza is often consumed casually, and people rarely consider the cumulative load of salt, fat, and additives they are ingesting in a single meal. For hypertensive individuals, regular consumption of frozen pizza can quietly accelerate vascular damage and worsen blood pressure over time. The most obvious hazard is sodium. Frozen pizzas are heavily salted in multiple components. The crust often contains added salt and dough conditioners. The sauce is frequently loaded with sodium. The cheese contains high amounts of salt, and processed toppings like pepperoni, sausage, or bacon are themselves sodium-dense. A single frozen pizza can contain well over 2,000 milligrams of sodium, sometimes exceeding the entire recommended daily limit for someone managing hypertension. Even sharing a portion of the pizza can contribute a dangerously high sodium intake, promoting fluid retention, increased blood volume, and elevated arterial pressure. Habitual consumption reinforces these effects, causing chronic stress on arteries, stiffening blood vessels, and raising the risk of left ventricular hypertrophy and heart failure over time. The second hazard comes from saturated fats and overall caloric density. Cheese and processed meats are not only high in sodium but also rich in saturated fats, which contribute to arterial stiffening, plaque formation, and systemic inflammation. The combination of sodium and saturated fat creates a dual mechanism for worsening hypertension. Sodium drives fluid retention and acute blood pressure spikes, while fats impair arterial elasticity and promote long-term cardiovascular damage. Over weeks and months, repeated consumption of frozen pizza can significantly accelerate arterial aging and reduce the heart's efficiency in pumping blood. Processed meats on frozen pizza add another layer of risk. Toppings like pepperoni, sausage, and bacon are high in nitrates, preservatives, and additional sodium. Nitrates may impair vascular function, while preservatives and flavor enhancers can contribute to inflammation and oxidative stress. When combined with high salt and saturated fat content, these toppings create a synergistic effect that elevates blood pressure both acutely and chronically. This is why frozen pizza is often described as a triple threat for cardiovascular health: sodium, fat, and processed additives all acting together to strain the heart and arteries. Frozen pizza is also particularly dangerous because of habitual consumption patterns. Many people eat it for convenience, often multiple times per week, without realizing how quickly sodium and fat intake accumulate. A casual pizza night can add as much sodium and saturated fat as an entire day's worth of safe intake. The cumulative impact of repeated consumption silently contributes to arterial stiffening, fluid retention, and long-term hypertension, often without obvious symptoms until serious complications arise. Another concern is the interaction with other dietary factors. Frozen pizza is frequently consumed alongside soft drinks, alcohol, or salty snacks, compounding sodium intake and metabolic stress. The combination of high-calorie, high-sodium foods and sugary or alcoholic beverages creates a perfect storm for blood pressure spikes and cardiovascular strain. Even individuals who are otherwise physically active can experience cumulative vascular damage if frozen pizza is a regular part of their diet. The subtlety of the risk is particularly insidious. Unlike obvious salty snacks, the harm from frozen pizza develops over time. Arteries stiffen, endothelial function declines, and kidney stress gradually increases. Chronic high blood pressure can become harder to manage. Medications may lose effectiveness, and the risk of heart attack, stroke, and chronic kidney disease escalates. The fact that frozen pizza is tasty, convenient, and socially normalized masks the silent danger it poses, luring people into repeated consumption while cardiovascular damage accumulates unnoticed. In conclusion, frozen pizza is far more than a convenient indulgence. It is a hidden, multifaceted threat for individuals with high blood pressure. Its combination of high sodium, saturated fats, and processed meats creates acute and chronic stress on arteries, heart, and kidneys. Habitual consumption promotes fluid retention, arterial stiffening, left ventricular hypertrophy, and long-term cardiovascular risk. For people managing hypertension, frozen pizza is not just an occasional treat. It is a dietary hazard that requires strict limitation or substitution with lower sodium, nutrient-rich alternatives to protect long-term cardiovascular health.